I'm Dr. Anthony Cave, a Stanford and Harvard-trained anesthesiologist and integrative medicine specialist, and I've guided over 1,000 patients through IV ketamine infusions. Here are the internet's best questions about ketamine therapy that my patients are too embarrassed to ask. What is ketamine therapy used for? Ketamine therapy can be a powerful tool for a variety of physical and psychological conditions, in particular depression, post-traumatic stress disorder, anxiety, and even chronic pain. What's special about ketamine is that because it appears to work on a completely different set of neurotransmitters than typical psychological and physical pain treatments, it can provide a rapid improvement in these conditions, like in a matter of hours versus weeks. What does a ketamine infusion feel like? IV ketamine is given as an infusion, and it is the most powerful and most potent experience compared to all the other forms of ketamine, like the nasal sprays or the sublingual lozenges. An IV ketamine therapy session can feel like an out-of-body experience in some ways. And if that sounds scary, which it does to a lot of patients initially, you need to remember that it is similar to other altered states of consciousness. The most common one is when you sleep at night, in your REM sleep, when you are dreaming. And there are some similarities to what that experience feels like in our dreams as it does when we're under the influence of ketamine in those therapeutic sessions. We often call this a dissociative experience, like we're disassociated with the physical body, but that's not necessarily a bad thing. Most patients, when they're in the right setting with a doctor whom they trust, actually have a very pleasant and healing experience that can give them tremendous insight. But of course, there's so many different nuances. It depends on where you're having the treatment and who you're with. I actually have a video of one of my patients during his ketamine infusion session because I think a video is worth a million words. It's linked in the description below. Is ketamine used in horses? Yes, ketamine is used in horses and other animals, but that's only because it was used in humans, in particular children and adults and even older adults first. Ketamine is an anesthetic used in the operating room for anesthesia and even in the emergency room, and it's been used there for over 50 years. This is how we know how safe ketamine is when used at these infrequent dosing. For example, when someone does a 6-session series for depression in just a couple of months. When ketamine is used for mental health or physical health reasons, it's not like you're fully asleep under anesthesia with a breathing tube or with one of these apparatuses in your mouth like surgery. These are much lower doses where patients are breathing safely and comfortably on their own. For IV infusions, patients will receive an IV, typically a pediatric size like this one. It's really not that uncomfortable when it goes in, especially if you ask your doctor to numb your skin first. Pandoria320 from Reddit asks, how do I know which form of ketamine I should do? Is one better than another? IV infusions, Spravato, troches, etc. This is a very good question, and you're going to find many different answers across the internet depending on who's trying to sell you what form of ketamine. All forms of ketamine have the potential to be very effective, but it depends on the patient, the condition, the severity of the condition, the time to relief, and whether the doctor is going to be present or not. So there's lots of nuances, but overall, IV ketamine in the form of infusions is the safest and typically viewed as the most effective form of ketamine. That's because 100% of the ketamine medication reaches your brain through your IV versus anywhere from 20 to 80% in the other forms of ketamine. You also can't control the ketamine dosage nearly as well with other forms of ketamine as you can with the IV, where your doctor is very precisely adjusting the dose and customizing it to what your body needs. Some conditions can't really be treated effectively without the IV. In particular, chronic pain, where the doses of ketamine needed are so high that if you took one giant lozenge, you don't know what's going to happen to your body, and you can't remove that lozenge out of your mouth after you've begun the absorption. So the IV route is preferred because you can dial in exactly the amount that you need, and if something unexpected happens, like a bad trip or an unpleasant experience, you can turn off the infusion, and the feeling will dissipate rapidly. You simply can't do that for the other forms of ketamine. Also, when you have an IV present, your doctor can give you other medications for your comfort that you can't do in the same way without the IV. For example, if you have a bad trip, the doctor can not only turn off the ketamine infusion, but can also give you medication in the IV to abort that trip faster. Some patients with PTSD might be more likely to experience a negative experience or something unpleasant, and having the IV route can make it that much more comfortable and even safer. Most ketamine sessions with a lozenge or a nasal spray also don't have the doctor directly there supervising the way that you have with an IV, where the doctor can very quickly make changes and help the patient feel better if something begins to go in the wrong direction. So you should always speak with your doctor to discuss why you're pursuing ketamine therapy, which form is best for the indication that you're seeking relief from, so that you can make a joint decision with your doctor. Free Will Lover on Reddit asks, what kind of progress might I see with ketamine? In general, ketamine can provide rapid symptom relief, but it depends on many variables, like what's the indication, how severe is the condition in that patient, how long has the patient had that condition. IV ketamine tends to be the fastest acting, often providing patients relief within the first session. How long that relief lasts depends also on other variables, but in general, after every subsequent session, the duration of relief is expected to last a little bit longer. So maybe session 1 will give you a couple days of relief. Session 2 should be a couple more days. Session 3, session 4, so on and so forth, to the point that once one is completed with the sessions, there should be multiple months, sometimes years of relief. Other forms of ketamine can certainly also provide benefit like that, but it's a lot less consistent in terms of the reproducibility of the response and what the timing looks like compared to the IV. Body Modding on Reddit asks, how does everyone here prepare for their treatments? This is so powerful because any altered state of consciousness has a heavy dependence on your mindset before you enter that altered state of consciousness. For example, before you go to sleep at night, you know that if you're anxious about something or worried about something or cold or hungry or uncomfortable, that's going to influence the quality of your sleep. You might have a nightmare, you might wake up feeling groggy or not well rested. For patients who are about to go under anesthesia with me, if they're fighting the anesthesia, they're more likely, I believe, to wake up fighting and maybe even be delirious as well. The same goes for ketamine. Patients who have trouble letting go into that experience, kind of like the dream-like state of sleep, might be less likely to experience all the positive benefits that ketamine can provide. Therefore, anything that can help patients be prepared for what to expect, speaking with your doctor before to maybe embrace your sense of curiosity, mindfulness, and truly self-compassion, I find can be very valuable in the mindset preparation. I personally spend over an hour with my patients helping them prepare for their very first session so they can hit the ground running to make the most of their ketamine sessions, starting with number 1. So very pragmatically, imagine if a nightmare comes up, kind of like a monster, like if you're having a dream and something scary happens. I want you to be prepared to engage with that monster. Why are you here? What are you here to teach me? What am I supposed to learn from you? Versus running in the other direction and inducing friction in that process. That can take a potentially healing experience and turn it into something that's scary and not productive. OKWall4603 on Reddit asks, how long or how many infusions until it helped you? The vast majority of studies investigate IV ketamine over 6 sessions. It's what I do for the vast majority of my patients. That's when patients reach their peak healing potential. For intramuscular sessions, that number is closer to 8. However, this experience is different from patient to patient, but on average, most patients are experiencing some symptom relief after their first session. And there's not as clear of a number for lozenges or for nasal sprays because those are not as consistent in their ketamine delivery, and there aren't as many protocolized approaches for those modalities. So a patient may begin to experience initial benefit that grows stronger and stronger with every infusion, and then after the 6th series is over, in some cases it might be 4, in some cases it can be 10, I've even done 12, where patients finally reached their right gear to heal. And after their initial series is over, what we call the induction series, some patients will return for a booster. Maybe it's once every 4 months, once every 6 months, once every 12 months for the IV. It depends on the patient. I always advocate for using the fewest number of interventions for the longest lasting therapeutic benefit, because that's good medicine and reduces the risk of side effects. So at the end of the day, a patient needs to decide whether taking an oral medication daily versus maybe getting 4 IV infusion boosters a year gives them the type of relief they're looking for in terms of reduction of side effects and overall well-being. These are very important points to discuss with your doctor. Rubix44 on Reddit asks, ketamine therapy alongside a prescribed antidepressant versus ketamine therapy just by itself? Another very good question. I try to help my patients wean off of antidepressants if that's what they want, if that's what their psychiatrist or prescribing doctor also wants them to do. In those cases, we'll start with both of them together, and then we'll slowly taper off the oral medications once we've established that the ketamine is beneficial. Patients should never stop taking a medication without first discussing with their prescribing doctor because of the risk of withdrawal effects or other side effects. Fortunately, ketamine has relatively few interactions with other medications, with the exception of stimulants or medications that can raise blood pressure or heart rate. So if a patient is receiving ketamine lozenges, there might be unsafe elevations in heart rate or blood pressure, depending on the medications that they're taking, that might not be able to adequately be treated depending on the setting that the ketamine is used in. When someone is getting IV ketamine, however, the patient has an IV in place, and the heart rate and blood pressure are being monitored very carefully, and we can treat elevations in heart rate or blood pressure. So there's very little concern from my perspective with my patients when we're in that safe, monitored, and healing environment. Cross-pollinated on Reddit asks, do people ever experience dependence or addiction to ketamine after therapeutic use in a clinic? A very good and nuanced question, because ketamine absolutely can be a drug of abuse, like benzodiazepines like Xanax or Klonopin or Ativan, or like opioids, or like many other medications that are prescribed. What's notable about ketamine, however, is that that risk appears very, very low compared to the other substances that I mentioned. Furthermore, especially with the IV form of ketamine, such a few number of infusions and treatments are needed for that effect that seems to also make that risk even lower. It's always about using the fewest number of interventions for the greatest therapeutic benefit to reduce these risks. So at the end of the day, while addiction can be absolutely devastating to one's life, we need to weigh that very low but real and serious risk against the risk of undertreated depression or chronic pain or PTSD, and also weigh that against the risks of medications that are often taken orally for years or decades at a time. And that's a nuanced discussion that you need to have with your doctor. How quickly until I feel better with ketamine therapy? In general, oral antidepressants can take 4 to 8 weeks for their symptom relief to kick in. Ketamine used sublingually can be maybe within 1 to 2 weeks. Ketamine spray like Spravato can be even faster than that, and IV ketamine is typically twice as fast as Spravato. So overall, ketamine is much faster than traditional forms of antidepressants. The IV form is going to be the most effective and fastest acting, but this data is primarily derived from depression. If we're talking about PTSD or chronic pain or anxiety, these results can be different. And just as a reminder, while IV ketamine sounds so effective, no medication is ever 100% effective for everyone, and ketamine is no different even with the IV form. How does IV ketamine therapy work? Ketamine therapy is different than traditional antidepressants, which are more of a band-aid type solution. You feel okay while you take them, and then your symptoms typically get worse when you stop taking them. Ketamine therapy, on the other hand, can help you feel better, and then after you stop using it, can keep helping you feel better. We believe it's due to sustained changes in self-representation, which, if we want to discuss neurobiologically, we might call neuroplasticity, coming from the root plastic, like plastic surgery, which involves molding, neuro referring to the nervous system. So neuroplasticity is like remolding your nervous system, helping you change your view of yourself, your view of your connection with the world around you. A lot of the root cause work that often underlies much of our depression, PTSD, or chronic pain. We know that ketamine blocks the NMDA receptor in our brain, and when we block that receptor, levels of a neurotransmitter named glutamate can rise, and that elevated glutamate can have cascading effects throughout our whole body, in our brain, our brainstem, and even our spinal cord, potentially conferring these effects. Levels of another neurotransmitter named GABA also appear to change in response to ketamine therapy, and this may also explain some of the effects. At the end of the day, ketamine is an anesthetic after all. It's used in the operating room to help patients be asleep and comfortable during surgery, and we don't understand really how any anesthetics work because that underlying subconsciousness of our mind is mysterious. It's an enigma to us in modern Western medicine. So the best we can do is try to explain our observations, but still have humility in explaining to patients the limitations of our ability to predict how any one patient will ever precisely respond to these potent treatments like ketamine or like any other psychoactive medication for that matter. What is the success of IV ketamine? Anywhere from 20 to 80% of patients receiving ketamine therapy will experience a significant improvement in their symptoms. Now that's a very wide range, and that's because it depends on what form of ketamine is used. Oral ketamine is typically in the 20 to 50% range. Lozenges can be comparable, a little bit higher, maybe 60%. IM or intramuscular edges closer to 70%. Spravato is in that range as well. And IV ketamine can be up to 80%, in my experience, sometimes up to 90%. Now, none of these are 100%, and no doctor should ever be telling a patient that something is guaranteed to work. That being said, the rate of success of ketamine, and in particular intravenous ketamine, is much higher than that of traditional oral antidepressants like SSRIs or SNRIs, and typically with fewer side effects. The number needed to treat for oral antidepressants, or the NNT, is around 4, meaning 4 patients need to be given a prescription for oral antidepressants for 1 patient to find benefit. That number is somewhere between 1 to 3, lower is better, for ketamine, depending on the route. I have a whole video on the number needed to treat linked in the description below. That being said, no medication is going to have 100% effectiveness for conditions like this, and no doctor should ever be selling ketamine as a panacea or as a unicorn rainbow, because that simply is not responsible, and patients should be given clear and transparent numbers and expectations to follow. What should patients look for in a ketamine clinic? There are many ketamine clinics out there, some of them responsible, some of them might not be as responsible, and it's up to the patient to be doing their due diligence to find the right clinic for them. I have a whole video on this linked in the description below, which you should definitely check out. But in brief, you want to be calling ahead of time, speaking with a doctor if possible, making sure there will be a doctor present. What kind of doctor are they? Are they a psychiatrist? That could be effective for lozenges, maybe even for nasal sprays and intramuscular injections. But for intravenous infusions, you really want to make sure there's an anesthesiologist or an emergency room doctor present. You want to know how long they've been doing this, what their preparation is like, what their integration is like, the process that comes after the IV infusions, what some of their statistics are like, and how they support their patients if, for example, they're having an unpleasant experience. How can they help reground the patient? While ketamine therapy can be very safe, we want to make sure that you're optimizing everything that you can for it to be effective, and effective for as long as possible. If you hear a clinic talking about boosters a lot, you might want to think twice about using them, because you don't want the emphasis to be on coming back for more and more treatments, but rather the emphasis on being, how can I use the fewest number of treatments to bring about the greatest and longest lasting benefit? Did you have any other questions about ketamine therapy? Let me know in the comments below. I practice in San Francisco. I have patients who come to me from all over the world because I emphasize this transparency for this otherwise mysterious treatment modality. And you should always speak with your doctor before ever pursuing something like ketamine therapy for depression, anxiety, PTSD, or chronic pain. Because while this can be very safe and effective, it needs to be done in the right environment with the right medical professional. This is certainly not medical advice, but encouragement for you to advocate for yourself and your loved ones to get the healing and the care that you deserve. And it starts by speaking with your doctor.